Dr. Abouljoud, you spoke a little bit about some of the myths, and while we're talking about those statistics, I think some people would like the idea of donating their organs to help a life. Maybe they have some reservations. They're not really sure of the process, or they're afraid of something. You've probably dealt with these issues, and why don't you just talk about them and address them?
Yeah, I mean, this is a very good question. There are many, many situations that deserve discussion, but maybe I'll touch on a couple that are probably most prominent. The first one is the issue whether your care will change once you have signed an organ donor card. In other words, you come in the hospital, you're in a car wreck, then people are picking up your driver's license, they realize you're an organ donor, and then you're afraid that they will not care for you the same way. The reality is the care team that cares for you for general medical issues has nothing to do with the organ donation community and the transplant community. These are totally separate, not connected, except in a very, very remote line that if, God forbid, you reach brain death, or you're going to withdraw the ventilator, through your family or doing that, then the question gets asked, are you an organ donor? And if it does get asked, that caring team is not involved anymore. They pass on all this information to the organ donation registry or people at Gift of Life, who then contact your family, have those conversations, verify that indeed you were interested in organ donation. So your care continues until that point is reached. That separation is critical, and some TV programs like ER, Chicago Hope, and all these other programs really did bad in the way they portrayed how transplants went on in those programs, showing that the same surgeon who was doing a heart procedure caring for a patient was the same one consenting a person for organ donation or a family, and then performing the donor procedure and then playing with the list of how he can push the heart. That is so untrue and incorrect.
And a person who's watching that program may just assume that that's fact and not realize it's not the true story.
We did send a lot of notes actually to the TV programs and the TV channels that they did the organ transplant community a disfavor by not consulting of how the actual scenario do occur. The second myth is the issue of organ allocation. Who gets the organ? The system in the United States for organ allocation is probably the most equitable system in the country and clear of all biases. It's blinded and it's patient-driven. So if a patient is listed in Michigan, in any center that they're listed, their name comes up first for the list through a computerized algorithm and not by people. We don't choose, the computer chooses. Then once your name comes up, then we track down which hospital do you work with, and then we contact your hospital. So it's not driven by institutions as much as driven by patients. The third one, which we discussed a little bit earlier, was the issue of religion and faith. Predominantly all religions that I'm aware of that are practiced in this country have made a statement in support of organ transplantation and organ donation. And I'm quite close and familiar with the Islamic community, and I've researched that extensively. And that's one of the also misconceptions that Islam does not support organ donation and transplant. And actually Islam quite clearly and succinctly made a statement on this as early as 1987, where they were supportive of organ donation, living organ donation and transplantation, as long as there is no experimentation and it serves to extend human life, because human life is valued in every faith that we know. And some of this information is well published and summarized both on the Gift of Life Michigan website as well as the United Network of Organ Sharing website, which is www.unos.org. It's the national organization that contracts with the government to assist in allocating organs fairly and equitably across the country.
And I think that's very important clarification of some of those sort of myths that are out there. I wanted to also ask you and touch base. There is quite a waiting list, and sometimes, unfortunately, people, don't make it in time before they arrive on the higher end of the list.
Yeah, that's obviously the unfortunate outcome of having less organs than you need. The waiting list overall has been growing every year steadily. partially because there is a mismatch between how many organs and donors we have and how many people are in need of transplant. And the list now is nearly about 100,000 people in the country waiting. Of those, about 75,000 are actively waiting on the list. The kidney list has been rising steadily with the same number of transplants being performed. The liver list has leveled off a little bit because of the current allocation system that favors the sickest first. So people no longer put patients on the list just to accrue time, because time is no longer a factor. It's the sickness index that does that. So that helped level off the list and get people who are sicker in for transplant. But still, the problem I deal with all the time is people dying while waiting.
It has to be awful.
It's very difficult. It's very difficult, and there is a lot of literature on this, both illustrating the sad medical side of it as well as the human side of it, where physicians care for a person, knowing if they had an organ, they'd be alive and well, and they're dying, and then they die waiting. And that's as many as 20 or 25% of people waiting for a liver transplant die while waiting.
And you were sharing with me a wonderful story to kind of bring a positive light to what can be done with organ donation about somebody in the local area at Cottage Hospital.
Yes, these are actually the stories that I think inspire a lot of us in the world of transplant, not only about what we do and validate the practice of transplantation and its contribution to human life, but also inspire us that there are people who are angels living on earth in our mind. And yeah, that individual was very special, and I hold him dear and close to my heart. He came in as one of my earlier patients to donate part of his liver to his loved one, and the procedure went terrific, and his liver regenerated without any episodes. And then subsequently, his another family member also needed a kidney transplant, and that person also went on to donate a kidney as well. Now, this is not an advertisement for people to do this on a routine basis, because I would admit I was not encouraging them to do that. I tried to provide them with different alternatives, but I think that when people are shaped that way and think that way, they have to change that altruistic penchant towards donating and helping others like that.
Obviously, it was a part of his spirit and his being to be that type of person, which is, he really is an angel.
He truly is, and I think that all donors are like this, to be honest with you. I think extending life, you know, whether you are deceased or through life, I think puts you on a different pedestal, I think, in a different world.
Let's talk a little bit briefly about some of the innovations that are going on in your department, or some of the newer up and things coming up, and maybe you could share that with us.
Sure. We're always trying to explore ways of doing things better, whether it is medications that reduce rejection. We have many trials involved with that, and or technical innovations that try to improve outcomes or expand the donor pool. Towards that end, many people, when they come in to want to donate a kidney to a loved one, it's very common not to have a good blood match, because you have to have a blood match to get a kidney through, you know, excluding unique medical things you have to work with. And the innovation that comes with this is called paired kidney donation. So if you have two pairs of people, each one of them has a donor, but their donor doesn't match, these two pairs can swap between their donor pairs so that the donor and the recipients will match. Now, you can easily see a situation where these two pairs do not match. So maybe you want to extend it to 3 pairs or 4 pairs. And this is where you get into the domino transplants, where one donates to 2, and 2 donates to 3, and 3 donates to 4, and then the donor for 4 goes back and donates to the first one. And that's kind of a nice sequence that goes that way. And there is a more recent one that is even more complicated. Suppose somebody wants to donate a kidney, and he doesn't have a loved one who needs it. He just wants to give it to the patient community. That's the altruistic donor. That person can actually open a chain that doesn't end, because he will donate to a person who has a donor but doesn't match, and that pair would continue until it closes the loop somewhere after 10, 15, 20 pairs have been transplanted, all made possible by one person who trickled the domino. And that's what people call the altruistic donor sequence and need. That's the short term for it. And that's kind of a nice innovation. So now with so promising that the UNOS, the United Network of Organ Sharing, is under the direction of the government, is sponsoring a national trial, and there are centers that are coordinating these trials, and our center is Johns Hopkins. We collaborated with them on a 7-pair last year, or actually almost 2 years now, on a 7-pair domino transplant, where we were involved, Oklahoma, Hopkins, and a bunch of other centers. And so we got 7 pairs just because one person decided to donate.
Really is a wonderful circle of life, great story of
really
paying
is.
it forward.
It really is, because it shows also a certain element of trust within the transplant community among professionals, and also among lay people who say, I trust my kidney to go on a plane for another kidney to come back on a plane for my loved one. The other innovation which we've had now implemented for the last 4 years, which is very unique, is the laparoscopic hybrid procedure for living donor liver transplant. We used to do the living donor procedure through the standard operation, which is about 15-inch incision, dividing through muscles. And of course, we thought we did the operation pretty well, but the pain and recovery from this was somewhat prolonged, and it changed the quality of life for the donor for quite some time. But their secondary gain, emotional and otherwise, was significant to it. They still were willing to go through the procedure. Now, for the last 12 years, we've been doing laparoscopic liver surgery at Henry Ford, and we extended that concept to the living donor liver transplant procedure. And now we're able to do the living donation through a 3.5 incision.
That's amazing.
Without cutting any muscles. And so the person 2 days later is wondering why they're in the hospital after having this major procedure now.
That's great. That's great. I wanted to briefly talk about, again, the Gift of Life of Michigan and the donation program. Say, for example, somebody is inspired to want to become involved in that.
Yes.
Tell us all about that.
Yeah, there is a lot of opportunities. Obviously, people can participate in any venue locally or with their hospital that they work with. But Gift of Life Michigan is the single organ procurement agency for the state of Michigan. We do not have more than one. It's a single state OPO, we call it. It's housed in Ann Arbor. They do have their own website with contact information and also how to get involved as a volunteer, how to register as a donor. They have a very robust and extensive outreach program that reaches throughout the state, that collaborates with high schools, community programs, local communities, and also the universities on campuses with student campaigns and what have you. And their phone number is 1-800-482-4881. And they're
Which I
also
think will be up on the
internet.
screen for our viewers.
Yes.
There.
And they also have a very good website also where they share good stories about transplantation, and also you can access the issues related to statistics, myth, and how to volunteer and get involved.
And that's really good. Say, for example, somebody has some questions or thoughts. They like the idea of that. It's a nice sort of comfortable, private way to find out more information and to get the correct factual information.
It is, and I think we have to spread the word. The reality is that transplantation depends on organ donation. Without organ donation, there is no transplantation. And there is no field like that, whether it is the eyesight, corneas, whether it is the heart transplant, whether even it's bone. And people do not think of that. I had one of my nurses who was going to lose her entire leg and thigh and hip for a bone cancer. But the orthopedic surgeon was able to remove the bone cancer and get a graft from a deceased donor and save her limb for over 10 years.
That's amazing. Well, you've given us fascinating information and a wealth of information. I really appreciate that. You've taken a lot of time out of your busy schedule, and we appreciate that.
Thank you so much.
Thank you so much for being on In a Heartbeat.
Thank you much.
And thank you to our viewers as well. We always appreciate you tuning in. And take good care of yourself and those around you. And have a great day. We'll see you next time.